Ever wondered why period cramps hurt so much? If you're curious about what's happening in your body during menstruation, you're not alone. Today we're going to explore the mystery of menstrual cramps, also known as dysmenorrhea. This topic might not get talked about often, but it's something many people experience. So let's break it down and understand why these cramps happen and what you can do to ease the pain. Every month, your body prepares for a possible pregnancy by thickening the lining of the uterus. When pregnancy doesn't occur, the uterus contracts to shed this lining, which results in your period. These contractions are triggered by chemicals in your body called prostaglandins. The higher the level of prostaglandins, the more intense the contractions and consequently the more pain you might feel. But that's not the whole story. Hormonal imbalances, especially involving estrogen, can also play a role in how severe your cramps are. If your body produces too much estrogen, it can lead to a thicker uterine lining and stronger contractions. Additionally, other underlying conditions like endometriosis, fibroids, or pelvic inflammatory disease can make cramps more painful. So if you've ever experienced intense abdominal pain during your period and thought it might be all in your head, it's not. There's a real biological process at work in your body that causes those cramps, so the pain is genuine and has a legitimate reason behind it. Did you know that the severity of menstrual cramps can vary widely from person to person? For some, cramps are a mild inconvenience, a slight discomfort that they can manage with ease. But for others, especially about 10 to 15% of women, these cramps can be so severe that they interfere with daily life, making it difficult to work, study, or even perform regular activities. Certain factors can increase the likelihood of experiencing severe cramps. Teenagers and young adults often have more intense cramps, which tend to improve with age. Women who have never given birth are also more likely to experience severe dysmenorrhea. If you have a family history of painful periods or anatomical issues with your reproductive organs, you might be more prone to intense menstrual pain. Knowing these risk factors can help you understand why you might be experiencing more pain than others. How to get relief from period cramps. Now that we understand why period cramps hurt so much, let's talk about how to find relief. You don't have to suffer in silence. There are several effective ways to manage the pain. Over-the-counter pain relievers, medications like ibuprofen or naproxen, can reduce the production of prostaglandins and help ease the pain. They're most effective when taken at the first sign of your period. Heat therapy by applying a heating pad or hot water bottle to your lower abdomen can relax the muscles in your uterus, reducing cramps. Warm baths can also provide relief. Oral contraceptives can regulate your menstrual cycle and decrease the intensity of your cramps by thinning the uterine lining, which means less contraction and pain. Stress can make cramps worse, so incorporating relaxation techniques like yoga, meditation, or deep breathing exercises can help. Yoga, with its gentle stretching and focus on breathing, is particularly beneficial. Lifestyle changes including regular exercise and a healthy diet can improve your overall health and reduce the severity of your cramps over time. Staying hydrated and reducing your intake of caffeine and salty foods can also help. If over-the-counter options aren't enough, your doctor might prescribe stronger pain relievers or hormonal treatments specifically for dysmenorrhea. Remember, every person's body is different. It might take some trial and error to find what works best for you, but don't give up. Your comfort and well-being are worth it. When to see a doctor. So, how do you know when it's time to see a doctor about your cramps? If over-the-counter medications aren't providing relief, or if your cramps are so painful that they disrupt your daily routine, it's time to consult a professional. It's also important to pay attention to pelvic pain that occurs outside of your period. This could be a sign of something more serious. If your cramps are accompanied by other symptoms like fever, nausea, vomiting, or abnormal discharge, don't ignore them. These could be signs of an infection or another underlying condition that needs immediate attention. Remember, your body is trying to tell you something. Don't hesitate to reach out to a healthcare provider if you're experiencing any of these symptoms. Your health is important, and seeking help early can make a big difference. So now that you know why period cramps hurt so much and how to find relief, what's your next step? Don't suffer in silence. If you're dealing with severe period pain, remember that medical help is available. Share the knowledge you've gained today with others who might benefit from it. Together, we can break the silence around menstrual pain and support each other in finding relief. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with others who might need this information. Don't forget to subscribe to our channel for more health tips and advice. Remember, you don't have to navigate period pain alone. Help is just a conversation away. Until next time, take care of yourself and listen to what your body needs.